Hi, this is a Noski Station video and I'll be talking about peak expiratory flow rate and inhaler technique as well. Okay, so hi, my name is Karan Rajan. I'm a fourth year medical student here. Doctors have just asked me to talk you through about how to use an inhaler as well as how to use one of these devices as well.
I see, okay.
Before we begin, could I just confirm your full name?
Mary Jones.
Okay, and your date of birth?
1st of January 1990.
Okay, so that will make you how old roughly?
22.
22, okay. So can I begin by asking if you know the reason as to why you're here today?
I have difficulty breathing.
Right, okay. And have the doctors ever mentioned that you may have something called asthma?
That's the one, yes. That's
asthma, okay. And how long have you noticed trouble breathing?
It's been there for some time.
Okay, yeah.
Only recently I decided to come to the doctors about it.
And you've discussed really with the doctors about the condition?
They said this should help me.
Yeah, okay.
Help me with the breathing.
So to begin with, I'm going to talk you through this device, and so basically this device will help us to sort of assess your lung function and how your breathing is day to day. Okay. So I'm just going to talk you through it step by step, and then I'll ask you to demonstrate to me, so I know you've understood all the information I've told you.
Okay.
So basically this is the end which you would blow through, and you'd use this, say a disposable mouthpiece, and you'd attach it to the end of that, make sure it's fitted in well, and make sure this dial here, this red dial, is at 0 every time you begin, and hold, put both your hands on the sides of the dial, make sure it's not obstructing it at all, and sit up straight, hold your head up high, put your form a tight seal around the mouthpiece, and then before that take a deep breath in and then blow out as hard and fast as you can. Imagine you're blowing out some candles across the room. Okay, so I'll just give you a quick demonstration. Okay, so something like that, and hard and as fast as you can, and you take the best of 3 readings. So I'll ask you to do it 2 more times after you've done the first one, and and make sure the device is not tilted either way, and make sure it's level. Okay. So again, once you finish with this, you can throw it away in the bin. Have you got any questions for me?
When should I use this?
Right, so I should mention that you should use this before and after you take your medication, so we know if any of the medication for your asthma is working or not, and all the readings you get from that, you can mark them in a diary which we'll give you, and so you note down the readings in the diary, and then you can look at the diary with your doctor so he can chart your progress and how your medication's working and how your lungs are improving.
Is there anything that says I'm normal or
yeah, so I'm glad you asked that. So now I'll just talk to you about this this chart that we have. Basically, this chart, which it's just a segment from your diary, you note down your readings in that, and then you'd you'd mark your readings in that, and then the doctor will be able to extract the graph from this, and he can compare this to values which are expected as normal, and we can figure out how your lungs are getting on day to day. So is there anything else you'd like to ask? Okay, so if you don't mind now, I'd like you just to give me a quick demonstration if you don't mind, just so I know that I've explained clearly enough, because I know I've been doing a lot of talking, so it's time for you.
So this is the device, and
Yep.
I need to put the mouthpiece on it.
Yep.
And I need to make sure that the red dial is at the bottom of the thing and not over there somewhere. And when I'm ready, I have to sit up straight.
Yeah.
Is that right? Okay, so I sit up straight and place my fingers around the side of the device like that. And I had to keep the thing straight as well. Okay. And do I have to breathe out?
So take a deep breath in and form a tight seal around the mouthpiece.
Okay. Okay.
Okay.
700.
That's pretty good.
Yeah.
So if you just, again, you could do that 2 more times. You don't have to do it now if you don't want to, but you can do it a couple more times.
Okay.
Yeah.
Yeah, just a bit over 700.
Okay, it's
Okay.
pretty good.
Thank you.
So yeah, once you get those readings, you note them down in your diary, and you have regular checks with your doctor, and he'll be able to assess how your lungs are functioning and if the medication that the doctor prescribes is having any effect at all.
Okay.
Well, that's me done. Is there anything on your part you'd like to ask?
No, none that I can think of at the moment.
Okay,
Thank you very much.
cool. Thank you very much.
Thank you.